Aloha, everyone. Thank you so much for joining us today. I am super excited to be here with our friends from the Hawaii Health and Harm Reduction Center, who are going to be going over some of the amazing services they provide to the community. We will be recording today's presentation because I know there were several people who emailed me who wanted to be able to attend to get this amazing information, and we'll host it onto our YouTube. That way you can review it or share it to anyone who wasn't able to attend today. But I don't want to hold us up. I want to go ahead and get into this amazing information that's being shared, and I'm going to go ahead and pass it over.
Aloha, good morning, everyone. My name is Andrew Ogata. My pronouns are he, him, his. I am the Community Relations Manager here at the Hawaii Health and Harm Reduction Center. I've been with the agency for a little bit over 4 years.
So aloha, I'm Kunane Dreier. I am the Health Equity Manager here at Hawaii Health and Harm Reduction Center. And I've been here for a very long time. I'll just put it that way. I started working here when I was 12, I like to say, 20 years ago. So yeah, welcome everybody.
We're really happy to be invited here to share a little bit with you. Just a snippet into kind of the things that we do here at the Hawaii Health and Harm Reduction Center. We call this presentation Harm Reduction with Aloha. So Hawaii Health and Harm Reduction Center, we have this long mission statement, but the real sum of it is that we work to reduce harm, promote health, create wellness, and fight stigma in Hawaii and the Pacific. We are the result of a merger of two longstanding organizations here in Hawaii. The Life Foundation, which was founded in 1983, and the Child Project, which was the statewide Syringe Exchange program, which was founded in 1989. Those two organizations merged in July 1st of 2018 to form the Hawaii Health and Harm Reduction Center. We still serve both of those communities. We still follow the mission of Life Foundation to serve those living with HIV, and the Child Project to prevent HIV spread amongst those that use drugs, but we've expanded our services to incorporate so much more than that now. These are just our values that we work with. Every single one of our programs, we try to look at it through a harm reduction lens with respect, advocacy, quality of care, compassion, and integrity. What we like to say is we kind of work at the intersection, right? So everything's related to everything. We work at the intersection of criminal justice, chronic diseases like HIV and hepatitis, mental and behavioral health, substance use, and houselessness. So every single one of our programs can kind of fall into one of these 5 categories or multiple of these 5 categories. Kunane, you want to go?
So I think we have, I think when we last counted about 24 programs. I think what's really important to know is that sometimes these will be delivered right there on the street, such as our wound care, syringe exchange, HIV, Hep C testing. So you could find some of our staff out on the street doing these services. Even some of our more traditional programs like HIV case management will go to the street and meet our people. And then also we like to do warm handoffs within our agency, whether it's internal or external. So before we bring someone to you, we want to do that warm handoff. So our people, our person will feel really comfortable with you folks. So that's something that we pride ourselves on. Okay, so I oversee the HIV Hep C testing and prep. So, anybody who's interested or in knowing their HIV or Hep C status, it's a rapid test right now, 20 minutes. You can come in or we can meet you on the street in outreach. And we also have at-home test kits, but we do this coupled with some counseling to talk about risk reduction, and then linked to other services that will help keep somebody negative, like PrEP, pre-exposure prophylaxis, right? It's a daily medication that someone can take to keep them HIV negative. We provide the education and the screening. Is this really appropriate? Is this the choice that they have for their HIV prevention, and then we get them linked to our navigator out here at HHHRC, and then they walk the person through that process to get them linked and then see the clinician to get the prescription. PrEP is biomedical prevention option and is changing the way the HIV is impacting our community.
And we provide free testing for the entire island. So pre-pandemic, we were averaging probably about 1,000 tests a year. We offer walk-in services to our office, like Kunane was saying, Monday through Friday from 9 to 4. And then we also do HIV and Hep C care coordination. So these are people that are living with HIV and hepatitis. We do wraparound services. We offer case management. We do everything from helping them find the right doctors, making sure that their insurance is okay, making sure that their housing and they're getting all the supportive services. We run weekly support groups, anything, any food insecurity, anything that someone living with HIV or Hep C is encountering, our medical case managers are there to kind of assist or link them to services that can assist. We also have a transgender services program. So we work very heavily in the LGBT&T communities. So our transgender services is called Kua'ana Project. And so Kua'ana in Hawaiian literally means the relationship from older sibling to younger sibling. And so we offer name change services, gender markers on birth certificates, on IDs, anything like that. They take them through the entire process of working with the Lieutenant Governor's office. It's a long process and it can be very daunting for someone. And we know that having your name and your gender marker reflect the correct gender identity and the correct chosen name is very important to someone's mental health and behavioral health. So we provide the service 100% free to everyone. We also run peer support groups, both for our elder transgender community, as well as our Beauty Blossom, which is our younger transgender community. We work out in the community with them. We also host 2 major events a year for the transgender community: Transgender Day of Visibility, which just happened on March 31st, as well as Transgender Day of Remembrance, which happens every November. LEAD is one of kind of our newer projects. I'd like to, when I say newer, it's less than 5 years old. It used to be called Law Enforcement Assisted Diversion, but you'll see at the top, it has a new acronym. It's called Let Everyone Achieve Dignity. And so what LEAD is a partnership with the Honolulu Police Department. And currently, if someone is constantly being arrested for low-level offenses, like say sleeping in a park or sleeping in the sidewalk, rather than constantly arresting this person over and over and over again and creating all this red tape and costing the taxpayers all this time and money, what they'll do is the police officer will call us and we will link them with a social worker and we will provide wraparound services and kind of see what we can do for them and see if okay, if we give you intensive case management, can we help you get to your next step, whatever that may be. Street medicine. So we have our medical director pictured here on the left, Dr. Christina Wang. She runs a street medicine program. Every Tuesday and Friday, she goes down into the streets of Chinatown and meets people where they're at. She will address any kind of wounds. She'll assess any kind of other physical ailments that's going on with them. And then she will either refer them to a specialist, either treat them right there, refer them to a specialist, have them come into the office so she can further treat them, or sometimes in some cases there's emergencies and she will call 911 right there for them. So Tuesdays and Fridays, she's on the streets of Chinatown. Mondays, Wednesdays, and Thursdays, she runs a free clinic out of our offices here in Kaka'ako. And this is kind of a really cool program for us. About 4 or 5 years ago, we had a financial auditor come in, and for every dollar that Queens Medical Center would spend on wound care in the ER, we can do the exact same thing for 5 cents. Overdose prevention, naloxone. For those of you that don't know what that is, naloxone is the drug that prevents someone from overdosing from opioids. The version that we give out is called Narcan, which is a like a Flonase looking like spray that you spray into someone's nose. And we are the statewide distributor for Narcan and naloxone for the state of Hawaii. So we train all of the different police departments on all the different islands, fire departments, things like that. We offer it free through our website. We also offer free trainings in the community. We just finished training a lot of the major hotels like Aloha, Kaimana Beach, the major nightclub scenes, Scarlet Honolulu, Hula's Bar and Lay Stand. So we're trying our best to get Narcan out into the community, because even though you may not be a user of opioids, but you'll never know like when you'll encounter someone that might be overdosing from opioids. Walking to your car in the parking lot, you might encounter someone overdosing. And so we really encourage people to carry Narcan on them at all times. Also, we have over 800 reversals reported specifically from our program. So when someone gets Narcan from us, they go out into the community, they come back, they're like, hey, we need another one. We ask them why they need another one. And then they tell us like, I had to use it on someone that I was at a party with or whatever, or I met in the parking lot. And so we have over 800 reversals reported just from our program. You want to talk about Hawaii's Last Drag?
Sure, I can. Andrew. Another one of the programs that falls under my umbrella is Hawaii's Last Drag is smoking cessation. So we are out there, you know, LGB&T, Native Hawaiian, substance use, mental health. These are communities that are disproportionately impacted by the impacts of tobacco and smoking. So we have a program that's targeting primarily the LGBT, but we also are working a lot within substance use, people using substances, treatment centers, mental health, these communities. So we are doing classes at different facilities depending on the location. We could also meet face-to-face, so one-on-one counseling and support around quit planning, what that looks like, what the person may need. We will provide them with NRTs if that's part of their journey. We will, phone, text, telemedicine. And then we also, just provide information so people can make their own choices on what this would look like to be tobacco-free. So Hawaii's Last Drag.
And we also offer a training institute. So this is another one of Kunane's programs, but I'm also a part of it with him. So this is a service that we offer to different businesses in the community, other partner agencies. We offer training in subject matter that we have expertise in. So like LGBT&T culture of humility, harm reduction 101, HIV, hepatitis, and STDs, mental health, first aids, a variety of different topics. We also, for many of the topics that we do offer, you can achieve continuing education units or CEUs for both social work and CSAT credits. And if you ever have a business or an organization that is wanting to have a training, or you think that you could benefit from having like a little bit more information on one of these subjects, you can go to our website, hhhrc.org, I believe it's /training, and you can fill out a request form, and Kunane will get back to you as to what we can do for you. Syringe Exchange program, we operate the statewide Syringe Exchange program. Hawaii had the very first statewide Syringe Exchange program in the country. We kind of credit this program to the low prevalence of HIV here in Hawaii, because we were so forward thinking, and the people that started our agency were so forward thinking. We were really able to get ahead of HIV. We run a syringe exchange on Kauai, Maui, Hawaii Island, as well as Oahu. And we exchange approximately 1.2 million syringes a year. That's 1-for-1 exchange. So you bring us 10 syringes, we give you 10 syringes. You bring us 1,000, we'll give you 1,000. And this is a really great program for not only our clients, but also for the community, because that way, people that are using syringes are not going to, when they're done with it, just throw it in the gutter. They're not going to like leave it for your pet or your child to find, because they know that they need to get new ones. So they will store them safely, and then they will bring them to us, and we will dispose of them properly, and we'll give them fresh, clean ones. And not only on top of that, it also helps us prevent communicable diseases throughout the population.
Me? Okay. Homeless outreach. This is a new many of our clients have come from this community, right? Experiencing houselessness. And so we have 2 programs now that we specifically provide services to our houseless communities. The first one, our Youth Homeless Demonstration Project, which we call Guide on the Side, or GOTS, right? We GOTS You, is specifically targeting LGB&T houseless youth, ages 18 through 24, and we provide navigation and other supportive services to get individuals that are experiencing houselessness on Oahu linked or ready to become, to move into, whether it's a shelter or into housing. And that can be through getting them document ready, IDs, that kind of thing. And then once they're housed, we provide on support so that they can become self-sustaining, right? Whether it be like looking for a job or just life skills, like how do I live on my own? This is the first time I've lived in an apartment, or whatever it may be. So we do provide that support. We also are part of the Mobile Crisis Outreach Hui, which are 5 agencies, and we respond to a crisis line 24/7. Most of our calls that do come in are not necessarily crisis related. But we triage, we see who's calling and what's going on, and then we try to get them linked. Now, we are not necessarily crisis providers, but we will respond and try to assist the youth that are calling the phone line. And we're out in outreach 5 days a week, all between the 5 agencies. We have 2 full-time staff that are lived experience. And then we have our state homeless outreach project, which is we call SHOP. So Region 1, from the stadium to Pi'ikoi, that big, huge area, we provide outreach to. And then Region 6, which is from Kahalu all the way out to Kawela Bay, right? So all of the windward, north windward. And we go out there and we provide, again, same thing, linkage, getting people engaged into the CES system. What are their housing goals? And then what's needed to get those achieve those housing goals, and we provide that support. And then we do coordinated outreach with other agencies and the police department and things like that once or twice a month in order to get people to shelter. Yeah, thank you, Andrew.
And then another program that goes kind of hand in hand with this, which we don't have a slide for, is we also run a stabilization center. In Waikiki, which is like it's a hostel that the city had signed a lease with the owner and gave to us to run. And so when we're interacting with people with our youth YHDP or SHOP programs, say like we meet someone and they're ready, like, hey, Andrew, I'm ready to go into this treatment center or whatnot. Like I'm ready to do all these things with my life. But maybe they don't have all their documents, all of their stuff got stolen. They don't have an ID, they don't have a birth certificate, they don't have any of these documents. Rather than me saying like, okay, well, you wait here on the sidewalk or in this park, and I'm gonna go try to find your documents and come back and find you, we can actually take this person and we can put them into our stabilization center where they can temporarily stay there and while we get things ready for their next step. And so that's something that we have control over. And so that's been a really great tool for us in aiding both of these projects. We also offer clinical and behavioral health services. Pictured here are 3 of our providers. We have our DNP, Dr. Christina Wang, who you saw earlier with her wound care program. So she's our medical director, but we also have JP Moses, who is an APRN, who works specifically with addiction medicine, and Angela Goff, who is a DO, who works on medications for opioid use disorders, as well as addiction medicine and psychiatry. So all of these services are also accessible. They can book appointments with them through our front desk. And it's also great for us to have this on staff because, as we said, things are related to things. So many of you might come in because you're HIV positive, but we might find out that you are suffering from addiction medicine, that you are in need of addiction medical services or anything like that. So we can kind of handle everything in-house. And we went over this already. So no wrong door, kind of what I just said, right? So you can access us through any one of these services, and we will internally, we can we can connect you to a number of different support services. And this is kind of like when we were envisioning the merger of Life Foundation and Child Project, we knew that we wanted to continue working with people with HIV, but we knew that the people that were living with HIV, we learned that the people living with HIV were being affected by all of these other things on top of just their HIV. You know, it's not just HIV. They were also suffering from mental health. We knew they were suffering from food access. We knew that they were experiencing houselessness. So that's how we kind of built our agency out from the core of HIV. This is where we are located. We're located at 677 Ala Moana Boulevard. You can come see us Monday through Friday from 9 to 4. Also, we don't have a silent, we need to add it in, but we have a new medical mobile unit called Ka'alave Pono that actually brings basically all of our services to rural parts of Oahu. So every Monday, they're out on the leeward side, either at the Waianae Boat Harbor or somewhere out in the Waianae side. They are in Ko'olau on a different day. So every day of the week, we have a medical mobile unit that brings all of our harm reduction services out to different parts of the island. And they can offer telemedicine appointments with our behavioral health specialists, or they can do telemedicine with Dr. Wang. So it's kind of a mobile office for us, but this is where we are brick and mortar located at Kaka'ako.
Andrew, I just wanted to add one last thing is, you know, although our agency has expanded and we now have this, you know, assortment of services to support our clients, our people as they come in to see us, or we find them on the street, or we also know that we can't do this all alone. So another thing that we really pride ourselves on are building bridges, building collaboration and partners within the community so that we can feel, you know, we know when we send them to see Amanda's going to be able to wrap around, you know, provide that. Amanda's going to be amazing providing the service. I'm just picking names, Amanda, but you know, that thing, right? And then same thing when you folks are referring clients to us, we want you folks to really feel like, oh, I'm going to send this person or link them to HHHRC because we know they do good work and they are good people. So it's really these collaborations and partnerships that really strengthen what we are able to do.
And we do have a couple questions I see, Kunane, in the question and answer box. So Danielle asked if we work with other islands and other organizations with trans services. Yes, we do several different things with Kumukahi Health and Wellness on Hawaiʻi Island. We also work with Tiare over in Maui at the Maui AIDS Foundation. So yes, our transgender services are very like fluid across the state. What kind of distribution of Narcan do you have to the neighbor islands? All of our Syringe Exchange fans on every single island provide Narcan distribution. We've also trained other organizations because we're the statewide distributor. We've trained like Kumukahi Health and Wellness to provide Narcan distribution, but also via our website, it's a really simple form you can fill out. It takes like 30 seconds and we will mail it to you free of charge. And PWID is people who inject drugs.
And really quickly, so people first language is so empowering to build the relationship between you and your client. Look, I'm just taking a moment, capacity building moment, right? People first, so someone who is living with HIV, someone who may be using substances, or person who injects drugs, right? It's about the person first and then whatever else may be, but that's, you know, when they're engaged in it, doesn't define who the person is. So we don't want to say drug addict. We try to, you know, HIV positive. We try to move away from some of this other stigmatizing language.
Thank you thank you so much for all this amazing information. Like I was pretty familiar with your programs, but clearly I had only scratched the surface. I was very amazed by some of the things you're saying, especially the outcome measures when you're talking about like how many people you'd reached, even the difference between like $1 and the ER versus like 5 cents, be able to do it through one of your programs. It very clearly shows the amazing impact that you're having through the community. We do have time for a few more questions. If anyone has any they'd like, please feel free to drop it to the chat or to the questions and answers box. But I just want to give you a big thank you for coming today. We will be sharing this recording again on our YouTube, and everyone who attended today will get a link to it. That way that you can share it with people, because I know I get a lot of questions around this. And every time I do the mental health first aid training, we always bring up your program for Narcan, and people always say like, and who do we contact again? So we drop it in there. So I know there'll be a lot of people accessing this after the fact. A lot of great jobs. Our example, Amanda. So you folks are amazing. Incredible work in the community. Love what you're doing. Definitely echo all those sentiments. If anyone has any questions regarding some of the things that we're gone over today, but they come up later as they're thinking about it, where can they reach out? Is there like an email or a phone number that's best for follow-up?
Yes, so via our website, there's a generic email that's info@hhhrc.org. If you ever have a generic question to go there, it actually comes to me. So I would be the one responding to you probably. So yeah, info@hhhrc.org is a great general.
Perfect. Awesome. Thank
The
you,
other
Kunane.
thing really quick, on the website too, though, like if you're interested in HIV testing or the Kunane project they have, you can actually go in there and put in your name and an email or somebody contact info and say I'm interested in an HIV test, or I have so a few of the programs have contact capacity right on our website also, and they would get emailed directly to that program. So myself or Maddie or HIV tester, things like that. And
yeah, a lot of our different programs, like if you're interested in smoking cessation is another one that has a referral form right on our website. PrEP services.
Awesome. I don't see any other questions coming in. I do want to go ahead and share with everyone, this will be in your follow-up email as well, but we at Mental Health America of Hawaii always love to hear feedback from everyone regarding the trainings. If there's some more information that you'd like to learn about, please let us know. It helps us figure out what people are trying to get more information on and resources they want to get more familiarized with. I've dropped that into the chat, but if you want to just wait, it'll also be in your follow-up email. I just want to thank Kunane and Andrew for joining us today so much and sharing this amazing information. Again, I was pretty familiar with it. I spent a lot of time with Heather in some different projects, and I still was like, I did not know they had that one. So I love hearing about all of the different outcomes and how you're positively impacting our community. We look forward to continue to support both of you and all the wonderful work you do. I'm going to go ahead and stop the recording.